Hello and welcome back to Unacademy. So let's crack NEET PG. Myself, Dr. Muskan Chaudhary, and I will be guiding you for NEET PG Microbiology. So today we'll be covering hypersensitivity and the types of the hypersensitivity. And very good morning to all. So as you know that Unacademy is India's largest learning platform and in which the daily life classes with the question answers and the educators, the topmost educators present on the Unacademy, they give the tricks and mnemonics to help you better learn the topics and to clear the doubts and the tricks for this examination, right? And one is the iconic subscriptions in which the prep letter has incorporated with the Unacademy, which in which the clinical and well structured essentials that are being covered with the video lectures and the question banks. The rapid revision, that is something that is very known to everyone, and the rapid revision courses are very famous for the Unacademy, for the prep ladder. And along with this, you get the perks of the Unacademy, that comprehensive and printed and digital notes with complete test and discussions to help you analyze your preparation. In the plus subscriptions, we get to assess the both the live and the recorded classes and learning from the topmost educators. And along with this, we can assess the Q banks. And as we know that the most of the videos from the Unacademy are actually totally free on the YouTube platform and the Unacademy platform. So you can study it whenever and wherever you feel like, specifically for those doctors who are the periphery and medical officers and they do not have the time for themselves to actually have the better access for themselves for the live sessions. So they can actually watch the recorded session and keep themselves updated with the notes and benefit from the watching your classes on the bigger screen. Special class features includes the interactive daily life classes, that is participate in the live chat with the educators and get your doubts clear, and poll for the learners are present. Raise a hand feature is something that is unique to the Unacademy, and on the app raise a hand feature is present, that is if you have any doubt you can actually get it cleared at the same time. Never miss a class because you get the notification from the academy whenever your favorite educator is going to start the class, so you will get a notification. And the lecture notes, that is you can download the lecture notes and get access to the recorded videos of live sessions and revisit the important topics whenever you need, and attend the live classes, participate in the live chat anytime and anywhere. Okay. One is the one is that if you get the 12-month subscriptions, you get the 2-month subscription totally free of cost, and do use my code, that is Muskan10, to get 10% of the discount, right? And compared with the Unacademy to the other online education platform, for a subscription it is about 60,000 rupees, and after 10% discount, and it is very economical and very cheap compared to other online education platform that is present online and the offline. And I'll recommend you to use at least 4 subscriptions, mainly for those who are actually in the college and they have sufficient of years for themselves to prepare, because nowadays they start preparing from the second year itself, so you can have the 4-year subscriptions, right? And for 1 year subscriptions it will cost you around 40,500 after 10% deduction, after 10% discount, and use my referral code, that is Muskan10. Okay, so now we'll study about the hypersensitivity and the types of the hypersensitivity reactions. There are basically 4 types of hypersensitivity reaction, that is 1, 2, 3, and 4. And how do we remember? We remember by the mnemonic, that is acid. Okay, that is acid, that is type 1 mainly anaphylaxis, atopic and allergic reactions. Type 2, that is cytotoxic. We'll read in detail a bit later. And type 3, that is immune complex. that is immune complex mediated. Cytotoxic, the type 2, and A for anaphylaxis, atopic, and the allergic, and D for delayed hypersensitivity reaction, that is mainly cell mediated, that is cell mediated immunity. ठीक है, तो मेनली हाइपर सेंसिटिविटी रिएक्शन दैट कैन बी रिमेंबर बाय द निमोनिक, बिकॉज डायरेक्ट क्वेश्चन पूछ जाता है कि टाइप 1 हाइपर सेंसिटिव इज व्हाट, टाइप 2 इज व्हाट, टाइप 3 इज व्हाट, टाइप 4 इज व्हाट, दैट इज एसिड, जैसे एनाफाइलेक्सिस, साइटोटॉक्सिक, इम्यून मीडिएटेड, इम्यून कॉम्प्लेक्स, एंड fourth one is the delayed type of hypersensitivity. Okay, now when we talk about the type 1 hypersensitivity, now type 1 hypersensitivity can be easily remembered by the numbers, that is 1, 2, 3, 4 and 5. ठीक है, अब इसको नंबर से अपन कैसे याद करें फॉर टाइप 1 हाइपरसेटिक, दैट इज टाइप 1, 1 फॉर टाइप 1, TH2, 3 for interleukin 3, interleukin 4 and interleukin 5. 4 is bigger because it is mainly interleukin 4 that is actually taking part in the type that is mainly responsible for the type 1 hypersensitivity. And another to remember is type 1, सबसे पहला अक्षर कौन सा, A, तो एनाफाइलेक्टिक, एनाफाइलेक्सिस, एटोपिक, एलर्जिक, ठीक है, एंड बी, ए के बाद बी, राइट, दैट इज A, B and C, that is B sting, and C for Cassoni's test. Because these are the examples of the type 1 hypersensitive. Main points are covered in this mnemonic as well. That is 1, 2, 3, 4 and 5. Once a type 1 hypersensitivity हम बात कर रहे हैं, TH2, T helper 2 cells taking part, interleukin 3, 4 and 5. It is interleukin 4 that is mainly responsible for type 1 hypersensitivity. And 1, 2, 3 से A, B, C आ गए, that is anaphylaxis, atopy, allergic, B से B sting and the Cassoni test, that is mainly the examples of the type 1 hypersensitivity. Okay, now then we are done with the mnemonics. We'll come to the mechanism now. So it was easy. Now what happens in the type 1 hypersensitivity is that any antigen or allergen when comes, ठीक है, नॉर्मली क्या होता है जब कोई एंटीजन या एलर्जन आता है वो पहले एंटीजन प्रेजेंटिंग सेल को प्रेजेंट होता है. वी रेड कि हाउ डज द एंटीजन कम्स, अपन जब एंटीजन एंटीबॉडी रिएक्शंस पढ़े थे उसमें देखा था कि एंटीजन फर्स्ट कम्स, इट इज प्रेजेंटिंग टू द एंटीजन प्रेजेंटिंग सेल. ठीक है, अब ये एंटीजन प्रेजेंटिंग सेल कहाँ जाएगा, बी सेल के पास. ठीक है, क्योंकि वो दिस टी सेल, सॉरी, ठीक है, तो सबसे पहले कहाँ जाएगा, टी हेल्पर सेल्स के पास, दैट इज TH2 सेल के पास जाएगा. एंड दिस TH2 सेल्स विल एक्टिवेट व्हाट, द बी सेल्स. ठीक है, और बी सेल्स का तो एक ही काम है, एंटीबॉडी बनाना. तो इन टाइप 1 इट इज मेनली व्हाट इज वन थिंग मोर, जब हम पढ़ा था ना कि 1, 2, 3, 4, 5, तो हमने क्या बताया, इट इज टाइप 1, इट इज व्हाट, इट इज TH2, इंटरल्यूकिन 3, इंटरल्यूकिन 4, इंटरल्यूकिन 5. इसके अलावा 5 पे अपना ये भी पढ़ा था, A, B and C, दैट इज एनाफाइलेक्सिस, एटोपिक, एलर्जिक, एंड B से B स्टिंग और C से दिस Cassoni's टेस्ट. ठीक है, एंड इंटरल्यूकिन 5 पे एक और चीज आएगी, दैट इज IgE, क्योंकि 5 फिफ्थ लेटर इज व्हाट, IgE, दैट इज मेनली इट इज IgE. एंड E से एक और चीज, दैट इज eosinophil रिक्रूटमेंट. ठीक है, नाउ अब बी सेल्स का किसका एक्टिवेट करेगा ना, बी सेल्स विल रिलीज व्हाट, IgE. नाउ दिस IgE व्हाट विल सेंसिटाइज द मास्ट सेल. ये अपना मास्ट सेल है. ठीक है, नाउ what happens that allergy when comes into the body, it will represent itself to the antigen presenting cell. Antigen presenting cell will represent this to the T cells through the T cell receptors, ठीक है, and what will happen, it will activate the B cells और B cells antibody बनाएगा, antibody कौन सी, IgE, और IG क्या करेगा, मास्ट सेल को सेंसिटाइज कर देगा फर्स्ट एक्सपोजर पे, ठीक है। इसके अलावा टी हेल्पर सेल्स, इसके अलावा और क्या काम करते हैं कि TH2 सेल्स जो होगा, दिट विल ऑल्सो रिलीज इंटरल्यूकिन 5 एंड इंटरल्यूकिन 3, ठीक है। अब उन्होंने क्या बताया था कि इट इज मेनली इंटरल्यूकिन 4 दैट इज टेकिंग पार्ट इन, दैट इज रिस्पॉन्सिबल फॉर हाइपर सेंसिटिविटी। तो वो कहाँ रिलीज होता है, यहाँ पे इंटरल्यूकिन 4, बिकॉज विद द हेल्प ऑफ द इंटरल्यूकिन 4 द टी सेल्स विल एक्टिवेट व्हाट, द बी सेल्स, सो दिस इज वेरी इंपॉर्टेंट दैट इट इज अ इंटरल्यूकिन 4। इसके अलावा अपने फोर्थ की तो अपने बात कर ली, 5 और 3 बचे, तो टी हेल्पर सेल्स ही इंटरल्यूकिन रिलीज करवा रहा है, तो इंटरल्यूकिन 4 का काम तो हो गया बी सेल्स को जाके एक्टिवेट करके एंटीबॉडी रिलीज करवाना। And apart from this, T helper cells is also release the interleukin 5 and 3, and this will cause what, the eosinophils recruitment, ठीक है। तो हो गया अपना वन फर्स्ट स्टेप, तो फर्स्ट एक्सपोजर पे अपना काम हो गया, एंटीजन विल कम इनसाइड प्रेजेंट टू द एपीसी, टी सेल बी सेल्स इंटरल्यूकिन 4 की हेल्प से, इंटरल्यूकिन 5 एंड 3 की हेल्प से eosinophil recruitment, and mast cell will be activated on the first exposure. So this was about the first exposure. When what happens, the when the same allergen, ठीक है, now what, the same allergen will comes on the second time, अब क्या होगा, सब कुछ सेम होगा, एंटीजेंस विल बी प्रेजेंट इन टू द एपीसी एंड इट विल बी प्रेजेंट इन टू द TH2 cells, interleukin 5 and 3 will be released and interleukin 4 will be released and it will activate what, the B cell. But now this will what, because the same allergen has come, this time the IgE is released in higher concentration, ठीक है। और जो sensitized mast cell पहले से sensitized सी, this will go to the mast cell and will cause the degranulation of the mast cells, and this will release what, the this histamine, and this will was called the this bronchoconstriction and the vasodilatation, okay, causing what, edema, ठीक है। तो दिस इज इजी। सेकेंड एक्सपोजर पे क्या होगा, सेम एंटीजन वापस आया, इट विल अगेन प्रेजेंट टू द एपीसी, टू द TH2 cells, and it is interleukin 5 and 3 and 4, this will activate the B cells, and this time the mast cells are already sensitized, so this time what will happen, the IgE on the same exposure of the second time of the antigen, they will be in higher concentration present, and they will do the degranulation of the mast cell that was already sensitized, and releasing what, the releasing the histamine, causing the bronchoconstriction and the vasodilation, increasing the vascular permeability and causing edema, ठीक है। तो अब इसके एग्जांपल्स क्या है, सो वेरी इजी टू रिमेम्बर, एग्जांपल्स तो हमने पहले ही देख लिया, दैट इज A, B and C, दैट इज A फॉर एटोपी, anaphylaxis and allergy और एंजियोइडिमा। B से अपना क्या था, बी स्टिंग्स, एंड C से अपना कैसोनीज टेस्ट। जस्ट टाइप 1 के लिए बस इतना याद रख लो, यू विल इजीली रिमेम्बर 1 2 3 4 एंड 5। 1 से अपने टाइप 1 की बात की, TH2, इंटरल्यूकिन 3, इंटरल्यूकिन 4 एंड इंटरल्यूकिन 5, ठीक है। इसके अलावा A 1 2 3 ABC भी है, तो एग्जांपल्स वी हैव ऑलरेडी सीन, एंड इंटरल्यूकिन 5 फिफ्थ लेटर इज आल्सो IgE, सो इट इज IgE दैट इज द मेन एंटीबॉडी टेकिंग पार्ट, एंड eosinophil रिक्रूटमेंट, ठीक है। एंड अपनों ने हाइपर सेंसिटिविटी को याद किया था एसिड से, दैट इज 1 2 3 and 4, that is type 1 is anaphylactic allergy, type 2 is cytotoxic, type 3 is immune complex, and type 4 is what, delayed or cell mediated immunity. Most of the questions will be done from here only, so easy to remember। type 1 के लिए if you do not even remember the mechanism that how it presents, just remember this type interleukin 4 that is mainly responsible, antibody that is asked is IgE and examples ABC, right? Now, coming to the type 2 hypersensitivity. Okay, now type 2 hypersensitivity, it is actually IgG and rarely टाइप 2 हाइपरसेंसिटिविटी अपनी क्या थी एसिड में दैट इज साइटोटॉक्सिक एंड आईजीजी रेयरली आईजीएम मीडिएटेड ठीक है नाउ व्हाट हैपेंस इट्स दैट इट इज टिश्यू स्पेसिफिक हाइपरसेंसिटिविटी रिएक्शन ठीक है इसका मतलब क्या है टिश्यू स्पेसिफिक दैट इज व्हाट antigen here is fixed and it will bind to specific tissues only. So when the antigens it bind to the cells of the host cell ठीक है कोई एंटीजन आया एंड एंटीजन मेनली इज व्हाट एक्सट्रिंसिक ठीक है क्या होता है कि कोई एंटीजन बाहर से आया इमेजिन दैट अ वायरस हैज कम और एनी एंटीजन हैज कम दिस एंटीजन विल बाइंड टू द होस्ट सेल ठीक है जैसे कि कोई भी सेल ऑफ द पर्सन यहाँ पे जाके अपना एंटीजन बाइंड हो गया नाउ नॉर्मली दिस सेल इज नॉट अ फॉरेन cell for our immune system but when the antigen has attached to the surface of our own cell this cell will be recognized as a foreign cell by the antibodies so what will happen the IgG and IgM antibody will recognize it as foreign cell and they will start attacking this cell, causing the activation of what? Complement system. क्योंकि हमने पढ़ा था कि कॉम्प्लीमेंट सिस्टम इज एक्टिवेटेड बाय विच एंटीबॉडीज दैट इज आईजीजी एंड आईजीएम एंड आफ्टर द एक्टिवेशन ऑफ द कॉम्प्लीमेंट सिस्टम विल कॉल द membrane attack complex and autoimmune reactions leading to the lysis of our own cells and causing the hypersensitivity reactions. तो टाइप 2 हाइपरसेंसिटिव में क्या हुआ कि आईजीजी आईजीएम एंटीबॉडी मेडिएटेड है कुछ नहीं हुआ कि बाहर से जब एक्सट्रिंसिक एंटीजन आया दैट इज टिश्यू स्पेसिफिक मतलब पर्टिकुलर टिश्यूज पे जाके it will get attached and those cells that are our own cells recognized as the foreign cells by our body and these will be attacked by the antibodies and these antibodies IgG and IgM are the cause for the activation of the complement system as well so complement system will get activated causing the release of the memory attack complex and causing the autoimmune reactions within the type 2 hypersensitivity ठीक है तो मेनली इसमें क्या आपने जो ना ऑटोइम्यून रिएक्शंस एंड दीज विल कम अंडर द टाइप 2 hypersensitivity and examples are easy to remember that is one is the rheumatic fever with pastures hemolytic disease of newborn myasthenia gravis and Atoplastic fetalis. Now, myasthenia gravis is an example of both the type 2 and the type 4 hypersensitivity and how, and we'll see it later. So, ये पूरा type 2 hypersensitivity in a short, in the concise that I've told you. Just remember the examples are very important. The autoimmune reactions that are coming under the type 2 hypersensitivity are rheumatic fever, myasthenia, good pastures, HDFN, and the erythroblastosis blastosis fetalis. So, this was about the type 2 hypersensitivity. Now, next we'll talk about the type 3 hypersensitivity. Now, we have already seen in the acid that it is what the immune complex mediated. ठीक है तो इम्यून कॉम्प्लेक्स का मतलब क्या इम्यून कॉम्प्लेक्स इज मतलब देयर इज accumulation ऑफ एंटीजन एंटीबॉडी कॉम्प्लेक्स that is freely present in the body and that are not cleared by body type 2 में तो क्या हुआ था कि एक बाहर से एंटीजन आया extrinsic एंटीजन mainly that has come and that is what attached to our own cell and उसके ऊपर अटैक हुआ एंटीबॉडी का तो एंटीजन एंटीबॉडी कॉम्प्लेक्स पहले नहीं बना ठीक है एंटीजन अपनी सेल पे अटैच होकर उसने एंटीबॉडी को अट्रैक्ट किया एंड लेटर द रिएक्शंस बट यहाँ पे एंटीजन एंटीबॉडी कॉम्प्लेक्स जो होंगे ना they are moving around in the body. ठीक है, and these immune complex, these antigen antibodies that are moving freely in the body, they will activate the type 3 hypersensitivity. अब यहाँ पे क्या होता है, जो एंटीजन जो एक्ट करता है ना, यहाँ पे कोई डीएनए फ्रेगमेंट हो सकता है, कोई प्रोटीन हो सकता है, तो इंट्रिंसिक हो सकता है, therefore activating the type 3 hypersensitivity reaction. Here antigen can be both endogenous as well and exogenous as well. That is both extreme. It can be intrinsic as well as extrinsic as well. And this will lead to what? Antigen antibody complex in the body that are freely moving, that are free. And what will happen कि जो antigen antibody complex जो free move कर रहे हैं, they will get lodged in the basement membrane. Basement membrane of what? The kidney or joints or any मतलब any system of the body, they will get lodged there. ठीक है, and what will happen now, this the antigen antibody complex, the antigen antibody complex it itself will activate the complement system. Here also the complement system will get activated and releasing what? The lysozymes and the inflammatory reactions and the reactive oxygen species. Now what are the examples of the type 3 hypersensitivity? That is SLE, serum sickness, glomerulonephritis, and arthritis. The classical examples of the type 1, type 2, type 3 we have to remember. Type 2 हमने rheumatic fever देखा, दो बच्चों का देखा, erythropoiesis faecilis and HDFN, and one is the myasthenia gravis and good Pasteur's disease. Another is the type 3 hypersensitivity, that is SLE, serum sickness, arthritis, and glomerulonephritis. That is the type 3 hypersensitivity. Now, when we talk about the type 4 hypersensitivity, now, type 4 hypersensitivity is what is it? It is a delayed hypersensitivity and cell mediated hypersensitivity, and here no antibody is taking part in the hypersensitivity reaction. Type 1 में it was IgE, type 2 में it was IgM, IgG, more IgG is mainly causing type 2, and type 3 में antigen antibody complex that was causing, and type 4 that is the delayed and the cell mediated, that is no antibody is taking part in the type 4 hypersensitivity. Now when a when the foreign antigens they come inside the body, mainly क्या होता है, normally the antigen that is taken up by the antigen presenting cell, and this is what we saw in the hypersensitive type 1, that it is taken by the APC, then T cell, then B cell, then antibody IgG is released. This is how the normal phenomena of antibody presentation takes place, antigen presentation takes place. But sometimes the foreign antigens they are what taken up by the dendritic cell. ठीक है, और डेंड्राइटिक सेल अब यहाँ पे एंटीजन प्रेजेंटिंग सेल का काम करने लग जाएगा, क्योंकि फॉरेन एंटीजन दे आर टेकन अप बाय द दे अटैच विद द डेंड्राइटिक सेल, एंड डेंड्राइटिक सेल विल एक्ट एज द एंटीजन प्रेजेंटिंग सेल, बट डेंड्राइटिक सेल विल एक्ट एज एपीसी विद द हेल्प ऑफ द major histocompatibility complex 2, that is MHC2, and this will release the interleukin 2. ठीक है, that means interleukin 2 will increase, that is MHC2. With the help of the MHC2, dendritic cell will present the antigen and increase the release of the interleukin 2 that is recognized by the CD4 T1 cells, and this will increase the release of the CD4 T1 cells, and this will release the interleukin gamma. Okay, so this is the basic mechanism, and the interleukin gamma will activate the macrophages, increase the macrophages, and macrophage will release what? Cytokines, right? And further activating the CD8 T cells, and this will what? Target antigen. They will act on the target antigen, and wherever the antigen is present on the organ, that is target antigen. ठीक है. तो टाइप 4 हाइपर सेंसिटिविटी में क्या, इट इज डिलेड हाइपर सेंसिटिविटी, क्योंकि इसका जो टाइम ड्यूरेशन होता है इट इज नॉट इमीडिएट. ठीक है. इमीडिएट हाइपर सेंसिटिविटी में टाइप 1, टाइप 2 एंड टाइप 3 आएंगे. टाइप 4 इज अ डिलेड and antibody is not taking part. We can clearly see antibody is not taking part in the type 4 hypersensitivity, and it is clearly cell mediated hypersensitivity and delayed hypersensitivity. 4 antigen आएगा, normally APC पास जाता है, T cell पास जाता है, but यहाँ पे dendritic cell पास जाएगा. And dendritic cells की I will do the work of the APC with the help of the MHC class 2, and 2 से interleukin 2 release हुआ. This will recognize by CD4 T cells, then activate the CD8 T cells, release the cytokines, and this is how the hypersensitivity reaction occurs. Now, examples we have to remember. One is what, the contact dermatitis. Another is the multiple sclerosis, diabetes mellitus 1, and TB. Okay. Now, type 4 hypersensitivity is delayed, that is D से T we can remember, that is the contact dermatitis and diabetes mellitus 1. इसके अलावा multiple sclerosis and the TB, we can remember that we are talking about the multiple sclerosis, so we can remember कि it is an aggressive disease occurring later. ठीक है. तो type 4 में आ जाएगा delayed multiple sclerosis and the TB, कि TB भी बहुत सालों बाद represent होता है, so we can just for the remembering it we can use this trick to remember. तो type 4 में D से T, diabetes mellitus 1, contact dermatitis, TB and the multiple sclerosis. टाइप 1 का तो अपने एबीसी से याद करे थे. टाइप 2 में मेनली द ऑटोइम्यून रिएक्शंस दैट वी सॉ, दैट द रूमेटिक फीवर, गुड पास्चर्स, एचडीएफएन बच्चों का, एरिथ्रोबाइसिस फीटलिस, एंड वन वाज द ग्रेव्स डिजीज. टाइप 3 में अपनों ने कौन सा देखा था, एस से एसएलई, एस से सीवियर दिस सीरम सिकनेस, आर्थराइटिस और ग्लोमेरुलर नेफ्राइटिस. ठीक है. एंड टाइप 4 में डी से डायबिटीज मेलाइटिस 1, डी से कॉन्टैक्ट डर्मेटाइटिस, एंड लेटर दैट इज अकरिंग टीबी एंड द मल्टीपल स्क्लेरोसिस. So this was the starting the class with mainly the tricks and the important disease that are included in the hypersensitivity. Now we'll come to the few points. Now, the purpose of the immune system is to eliminate the foreign antigens that have entered into the host. In most instances, immune response leads to only a subclinical localized inflammatory response which just eliminates the antigen without causing any significant damage to the host. However, sometimes the response becomes abnormal and leads to an exaggerated inflammatory response, and this is hypersensitivity, that is exaggerated inflammatory response, causing extensive tissue damage and even death in anaphylactic shock that we see, and even death. So hypersensitivity reaction is nothing but it is a self-exaggerated inflammatory reaction that normally doesn't happen, but when it happens causes extensive tissue damage and even death. Now, hypersensitivity reactions definition. The term hypersensitivity or allergy refers to the injurious consequences in the sensitized host following subsequent contact with the specific antigen. Now, gel and the Coombs classification. Following the antigen, hypersensitivity may occur immediately or even after few days. ठीक है. Immediately या फिर after few days. So it may result from an abnormality of either humoral or cell mediated immunity. ठीक है. That is after few days is what delayed. So it is mainly what cell mediated and under humoral. Based on about two features, gel and the Coombs classification. Immediate में अपन कौन से आएंगे, type 1, type 2 and type 3. That is, these reactions occurs immediately within few minutes to few hours as a result of abnormal exaggerated humoral response, right? So, and they are type, all the immediate hypersensitive reactions, they are what, they are antibody mediated, जबकि type 3 is cell mediated, therefore they are not antibody mediated. That is, they were dendritic cell and MHC class 2 mediated. This can further be classified into three types, that is type 1, 2 and type 3. Type 1 we've already seen, we use a mnemonic 1, 2, 3, 4 and 5. That is one set type 1 we are talking about. Also we're talking about the first letter A, that is atopic allergic anaphylactic. 2 से अपनों ने We remember TH2, interleukin 3, interleukin 4 and interleukin 5. 4, 5 पे IgE आता है and fifth letter for the IG and E से eosinophil recruitment. 2 से B letter, that is the bee sting. 3 पे C, that is the Cassoni's test. So this summarizes the type 1 hypersensitivity reaction along with the example. Type 2 hypersensitivity reaction, we see that it is mainly IgG or rarely IgM mediated, which causes the complement activation. We saw how the complement system was getting activated, or antibody dependent cellular cytotoxicity in response to cell surface. Right, and what were the examples? The autoimmune reactions, mainly rheumatic fever, good pastures disease, myasthenia gravis, HDFN, and erythroblastosis fetalis. And here what happening? Mainly the exogenous antigen वो जाके चिपक जाता है अपनी सेल से, तो वो सेल फॉरेन सेल रिकग्नाइज होती है एंटीबॉडीज से, एंड दिस विल एक्टिवेट द कॉम्प्लीमेंट सिस्टम. ठीक है, so this is what the antibody dependent cellular cytotoxicity. And remember the mnemonic acid, that is A say anaphylactic first, type 1, type 2 cytotoxic, type 3 immune complex, type 4 delayed. Now, coming to the type 3 hypersensitivity, it is what we have seen, it was immune complex antigen antibody complex mediated, which are found between the interaction between the soluble antigen and the antibody, resulting in an abnormal inflammatory response. And these immune complex antigen antibody complexes, they वो लॉज जाते हैं basement membrane पे, and therefore activating further the inflammatory response and the complement system. And what were the examples? सारे SS से we remembered कि SLE, ठीक है, serum sickness, arthritis, glomerulonephritis, ठीक है. Coming next to the delayed or the type 4, that is the type 4, it is what delayed or the cell mediated immunity reactions, that is it was not antibody mediated, and they were what MHC class 2 mediated with the help of the dendritic cell activating CD4 T cells, CD8 T cells, right? So they occur after few days, इसलिए delayed है as a result of abnormal CMI, and this is called as the type 4. And whatever example D से D सारा, that is the diabetes type 1, contact dermatitis, and since it is delayed we remembered it is जो rare disease presentation है, that is one is TB and the multiple sclerosis. Now type 1, type 2, type 3, 4. Of type 1 we have seen it is IgE, IgGM. Type 3 is the immune complex mediated and mainly the antibody is IgG. Type 4 is what? T cell mediated. ठीक है. Now time period 1, 2, 3 and 4. Type 1 mainly occurs within an hour and it occurs hour to day, and this is 1 to 3 weeks and delayed from days to weeks. ठीक है, examples we have already seen. Now coming to some differences, immune reactant we have seen type 1 it is IgG, antibodies we've already seen. Now for the type 1, type 2, type 3 and type 4, now antigen, type 1 it is a soluble antigen, that is extrinsic antigen that was coming to the body. Type 2 it is cell bound antigen, बिकॉज सेल बाउंड एंटीजन क्यों है, क्योंकि हमने क्या बात की थी, जो एक्सटेंसिंग एंटीजन जो आ रहा था वो अपनी सेल के साथ पहले बाइंड हो जाता है, अटैच हो जाता है, जो सेल जो अपनी सेल्स थी वो फॉरन लगने लग जाती है अपनी एंटीबॉडीज को, तो इट इज सेल बाउंड एंटीजन, जस्ट रिमेंबर दिस. ठीक है, टाइप 4 में सेल बाउंड भी हो सकती है और ना सॉल्युबल एंटीजन भी हो सकता है, क्योंकि टाइप 4 में अपने टाइप 4 दैट इज व्हाट it was mainly not the antibody that were taking part, it was mainly what the dendritic cell that was acting as the APC. Examples we have already seen. This is another mnemonic for the type 1, 2, 3, 4 to remember, but you've already remembered it by the mnemonic, that is acid. Now, type 1 hypersensitivity, the hallmark is the production of what? Production of what? IgE. And we remember the mnemonic 1, 2, 3, 4, 5. ठीक है, टाइप 1 में दैट इज टाइप 1 वी आर टॉकिंग अबाउट TH2, interleukin 3, interleukin 4, interleukin 5, and 5 is also IgE or eosinophil recruitment A, B and C. 1, 2, 3 पे A से Atopy anaphylaxis, B से bee sting and C से Cassoni's test. So the pharmacologically active mediators released from these granules cause vasodilation, क्योंकि second exposure पे mast cells का degranulation हो रहा था, causing the bronchoconstriction and the vasodilation, increasing the vascular permeability. These changes ultimately lead toward the localized response that is called as atopy or the anaphylaxis. We already remember type 1 में 1 पे A से A, that's atopic, allergic, anaphylactic, B से bee sting and C से Cassoni test. So allergens are the foreign antigens that induces what? That induces the allergy. And the experiments to demonstrate in the starting of the class only हमने type 1 के बारे में सब कुछ important चीजें पूछ जाती है. We already discussed for the type 1, type 2, type 3 and type 4. Now a little bit of theory I will cover just for those students mainly who want to give the professional examination as well. Now experiments to demonstrate type 1 reaction. Several experiments were conducted in the past to demonstrate the type 1. Now one of which one is the PK reaction. In PG, as such question is not asked from the PK reaction. That is the PK reaction. What is the Prosnitz and the Kussner's? Prosnitz and the Kussner reactions, because they were first to demonstrate that the antibody in serum is mainly actually responsible for the allergy. ठीक है. So PK reaction is what? It is named after the name of the scientist, that is the Prosnitz and the Kostner. That is they saw that it is an antibody, क्योंकि हमने type 1 2 3 में देखा antibody dependent reactions थे, so it is antibody in the serum that is mainly causing what? The inflammatory reactions. And serum from an allergic person is injected intradermally into non-allergic individual, and later when the appropriate allergen is injected, the same type weed and flare reaction. It is actually they conducted the type 1 reaction. उन्होंने पहले क्या किया कि एंटीजन को इंटरडर्मिनली एक्सपोज किया पर्सन से जो कि नॉन एलर्जिक था, फिर सेकंड एक्सपोजर अपने सेम एंटीजन से दिया. सो एक्चुअली दे सो व्हाट? दे सो द व्हील एंड फ्लेयर रिस्पॉन्स. This is what? This is the PK reaction. Now, the wheel and flare response occurs in the three stages. That is, it begins with the appearance of the erythematous area. ठीक है? Wheel and flare response is asked in the mainly in the stare examination. So first it will begin with the erythematous area. That is after followed by the development of the area of flare surrounding at the side. That is flare. Finally, and wheel. That is the swelling and the congestion. Congestion due to the accumulation of blood in the surrounding capillaries, so causing what? The erythematous, followed by the flare and the wheal response. That is the wheal flare response. May wheal swelling and the congestion will appear at the last stage, right? Wheal and flare response. Now mechanism we have already seen that it is the first sensitization phase होगा, फिर effector phase होगा. ठीक है. तो sensitization phase हमने कैसे देखा था कि कोई भी एंटीजन आता है, it will present to the APC normally. ठीक है. APC will present it to the TH2 cell. This will present to the B cell. ठीक है. अब TH2 के दो काम है यहाँ पे. ठीक है. मेनली इट वाज TH2. अपन ने क्या देखा? इंटरल्यूकिन 4. तो विद द हेल्प ऑफ द इंटरल्यूकिन 4 बी सेल एक्टिवेट हो जाएंगे एंड बी सेल क्या IgE बनाएगा और वो जाके मास्ट सेल पे चिपक जाके सेंसिटाइज कर देगा फॉर द सेकंड रिएक्शन. और TH2 का एक और काम था, इट वाज रिलीजिंग व्हाट? इंटरल्यूकिन 5 एंड 3 एज वेल, क्योंकि अपन निमोनिक में देखा था. तो 5 एंड 3 इसके कॉजिंग व्हाट? द इओसिनोफिल रिक्रूटमेंट एंड कॉजिंग व्हाट? द सेम इन्फ्लामेटरी रिएक्शंस. तो सेकंड एक्सपोजर पे सब कुछ सेम होगा, बस क्या चीज डिफरेंट होगी सेकंड रिएक्शन में कि जो बी सेल जो IgE बना रहा था, अब सेम एंटीजन आ गया, अब IgE बहुत ज्यादा नंबर में बनेगा, concentration will increase and this will जो sensitized mast cell था उसका degranulation हो जाएगा, releasing the granules and causing the increasing the vascular permeability, causing the bronchoconstrictions and causing the vasodilatations. ठीक है. So, type 1 hypersensitivity reactions occurs to the two phase, sensitization and the effector phase. Sensitization phase हमने देखा जब individual first time is exposed to the or priming dose of any allergen or the antigen, and it is most effective when the allergen is introduced what? Parentally. Okay, so this is also a question that it is most effective when induced what? Parentally. Now, in susceptible individuals, every minute dose can be even minute dose can be sufficient to sensitize the host. The allergen is processed by the antigen presenting cell because it was taken up by the antigen presenting cell, and the antigenic peptides are presented to what? The CD4 T helper cells. ठीक है, activated T helper cells are differentiated in TH2, which secretes the interleukin 4, and this is the same theory we have already read in a single line. Interleukin 4 will induce the B cells to differentiate into the IgE and the memory cells, and many molecules of the IgE will against specificize against the various epitopes of the allergens, and the secreted Ig migrate to the target sites and the coat the surface of the mast cells. FC region of Ig binds to the high affinity FC receptors. This is not to remember क्योंकि हमने पहले एंटीबॉडी में पढ़ लिया था कि एक सिर्फ है ना फैब रीजन जो होता है वो जाके एंटीजन पे बाइंड होगा, बाकी कुछ भी चिपके एंटीबॉडी के इट विल ऑलवेज अटैच टू द एफसी रीजन. कंफ्यूज होने की जरूरत ही नहीं है, सिर्फ फैब रीजन पे एंटीजन बाइंड होगा. रेस्ट ऑफ वॉट एवर द सेल्स दैट आर गोइंग टू अटैच विद द एंटीबॉडी विल ऑलवेज अटैच एट द एफसी रीजन. Thus, sensitized mast cell that are coated with the Ig will be waiting for the interaction with the subsequent antigen. Now, when the same allergen is introduced, we are talking now about what the effective phase. So, when the same allergen is introduced again, that is known as the shocking dose. ठीक है, तो पहले तो हमने प्राइमिंग डोज की अपनों ने बात की थी, that was responsible for sensitizing. Now when the secondary dose is given or the shocking dose is given, it will directly encounter the fab region that are already coated with the IgE, and cross linkage interacts initiates the degranulation and triggering the mast cell and releasing the granules, and the memory cells further differentiate into the plasma cell that produce the IgE. So degranulation occurs and mast cells and basophils undergoes the degranulation in the two phase. That is, one is the, because we know that granules होते हैं, primary granules or secondary granules, we have read about that. That is, one is the primary mediators or the preformed chemical mediators, that is the granules that are already present inside the mast cells. And it is, you must have read this in patho because it is also important that what are the granules that are preformed, that are already present in the mast cell. These are what? Histamine and the serotonin. Okay, these are the preformed, that is histamine and the serotonin. They are preformed granules that are present in the mast cells. And we talk about the secondary mediators, that is the secondary granules that are released by the mast cells. That is, the mast cell will synthesize after stimulation by any antigen and allergen. An example is what? The prostaglandin and the leukotrienes. That is, they are not the preformed, they are later synthesized by the mast cells. And these chemical mediators will show the this bronchial constrictions and increase the vascular permeability by causing the vasodilatations. And these actions will produce the breathlessness and the hypotension, causing what? The hypotension, and if severe, causing what? Shock and even death. Okay, so this was about the type 1 hypersensitivity. Now, how does the manifestation of the type 1 reactions occurs? Now, manifestations are further grouped for the type 1, although type 1, type 2 and type 3 as examples of the immediate hypersensitivity reactions, but the manifestation will be immediate and even late. So, they are what? Immediate and the late manifestations. Now, what is the immediate? Wherever anaphylaxis is occurring, it is an immediate. So, systemic anaphylaxis हमने एबीसी में पढ़ लिया था, एटोपी, एनाफाइलेक्सिस एंड एलर्जिक, दे आर व्हाट? टाइप 1 hypersensitivity. So systemic anaphylaxis is an acute emergency condition and that is characterized by severe dyspnea, hypertension and the vascular collapse. It occurs within minutes of exposure. If unless treated promptly may lead to fatality. So immediate is what? The systemic anaphylaxis, and the wide range of allergens have been shown to trigger the anaphylaxis, including the venom, bee wasp and the bee stings that we saw, and the drugs that we have to remember: penicillin we already know, and the even insulin, seafoods and the nuts. Epinephrine adrenaline is a choice for the anaphylactic reactions. We know this, the anaphylactic is adrenaline is what the drug that is given. And allergens, what are the allergens that can act? That is, we are seeing the bee wasp and the venom. Okay, and penicillin and the insulin. In the drugs, that is the penicillin we already know and insulin. Okay, now mediators of the type 1 hypersensitivity we have. This is very important slide because mediators हमको preformed और newly synthesized mediators के नाम याद होने चाहिए. Histamine, heparin, serotonin and the eosinophilic chemotactic factors, they are preformed data. They are already present inside the mast cells and newly synthesized, that is the prostaglandin and the leukotrienes we saw and the thromboxanes, that is thromboxanes that are, and the slow reacting substances that are SRSA. Just a second, I got a call from the department. तो अपन कहाँ पे थे? अपन कहाँ पे थे? Okay, so we were at the mediators of the type 1 hypersensitivity, and they are important to remember that preformed mediators that are already present inside the mast cell, that are histamine, histamine, heparin, and the serotonin. That is the most of the mediators जो अपन normally सुनते हैं, they are preformed histamine, heparin, and the serotonin, and eosinophil ECAF factor A. That is eosinophil chemotactic factor for the anaphylaxis. Now, newly synthesized, we have to remember this prostaglandins and leukotrienes and the thromboxanes, and the slow reacting substance, that is SRSA. Now the mechanism of the type 1 we've already seen, so I will not repeat it. We have repeated almost it two. We have already revised this 2 to 3 times about the type 1. सब कुछ mnemonic से हो जाएगा. Just remember the mnemonic 1 2 3 4 5 and ABC. उसमें पूरा type 1 reaction आ जाएगा. Now next is the localized anaphylaxis. Systemic तो anaphylaxis था, anaphylactic shock, and the localized is what? Atopy. ठीक है, तो अपन बात करेंगे एटोपी की. हेयर द रिएक्शन इज लिमिटेड टू स्पेसिफिक टारगेट टिश्यू एंड ऑर्गन, मोस्टली द एपिथेलियल सरफेस, क्योंकि नाम ही लोकलाइज्ड है, तो इट इज एटोपी एंड इट विल लोकलाइज्ड टू अ स्पेसिफिक टिश्यू और a specific organ, mostly the epithelial surface at the entry site. Mainly it is mainly at the entry site. जहाँ पे एंट्री हुई है वहीं पे मेनली इट विल शो द atopy. These allergic afflict more than 20% and they always runs in the families, that is they are what? They are mainly inherited. ठीक है, atopy is generally inherited and what are the examples includes the allergic rhinitis. ABC सब याद रखो, अगर ATP का कोई example it will come under the type 1, that is one is the allergic rhinitis or the hay fever, that is it is the most common atopic disorder occurring about 10% of the population, so allergic rhinitis, and this results to what? The exposure of any airborne allergen with the conjunctiva and the nasal mucosa leading to appearance of the system such as watery secretion. I guess allergic rhinitis तो हर किसी को हो जाता है. Most of people that I've seen around mainly क्योंकि सफाई भी करे तो उनका नाक बहने लग जाती है, watery eyes आता है. That is this results from the exposure of the airborne allergen, increasing what the watery secretions of the conjunctiva, mucosa, nasal mucosa, and the upper respiratory tract, as well as sneezing continuously and the coughing. So allergic rhinitis. That is the most common. Another is the asthma. That is the second most common, right? It differs from the hay fever in the involvement of the lower respiratory tract, resulting in the contraction of the, that is the bronchiosmooth muscles, and increasing the mucus secretion. So atopy, that is A for A, that is one is the allergic rhinitis, and another is the asthma that we have to remember. Okay, that is if we, when we remember the examples, that is A, B, and C. A say anaphylactic reactions and the anaphylactic shock, and the atopy, atopy में A से allergic rhinitis and the asthma. And इसके अलावा allergic asthma, it is induced by the airborne or the bloodborne, and intrinsic, that is mainly intrinsic introduced by the exercise or the cold. This is important to remember. Intrinsic किससे होता है? Intrinsic क्योंकि medicine का question है, intrinsic is by this exercise and the cold, and the allergic by the extrinsic airborne or the bloodborne, that is the pollens, dust, and the fumes. Food allergy. Various food can also induce the localized or the atopic individual. In atopic individuals, the food allergies, that is nuts, that is some have the peanuts की allergy होती है, seafood की allergy. They can stimulate the mast cell that is lining the mucosa of the gut and cause the GI symptoms, causing the diarrhea and the vomiting. And when the allergies, when the same allergen is exposed to the skin, this will cause the wheal inflammation. क्योंकि अगर अपन खाएंगे so they will show the symptoms of the gut with the diarrhea, and when they are exposed to the skin, they will show the symptoms of the wheal and the flare signs, right? Now, atopic dermatitis. Contact dermatitis was coming under the type 4, and atopic, that is A say A, that is it is an inflammatory response of the disease that is frequently associated with the young children with the family history, right? It often develops during the infancy. Drug allergy, that is penicillin, insulin, and the sulfonamides may produce the type 1 hypersensitivity. Now, coming to the late manifestations, the immediate phase ones we have seen is followed by the late, that is after 4 to 6 hours later, by inflammatory response. This may last for 1 to 2 days. Mediators, they are released in the acute phase along with the cytokines 3, 5, and 8, and among the infiltrated eosinophil and neutrophils. Influx, it is favored by the eosinophil chemotactic factor. Also important to remember, what is important we have already covered. Neutrophil inflammation, it is induced by the neutrophil chemotactic factor, other cytokines, and the activated neutrophils release the various mediators, that is increasing the inflammatory response of the person. This is the type 1 same. Now we have, this is the same, this is the wheal and the flare response. Wheal will occur at the last, this is swelling at the condition. First will occur, before the wheal will occur the flare. ठीक है? You can see the flare response. So it is the wheal and the flare response. ठीक है? 1, 2, 3, 4, 5 is importance. Mediators, we have to name the, remember the primary and the secondary mediators, that is the preformed mediators and the mediators that are synthesized later. Now, factors influence. What are the factors that are influencing the type 1 hypersensitivity? Now, we have seen the atopic dermatitis or the asthma. They are hereditary. Mostly they are hereditary. So, genetic makeup. Now, host genetic factors play an important role in mounting an immune response against an allergen. Some individuals mount a normal response, whereas some mount an exaggerated immune response. These are several gene loci identified which encode proteins that are involved in the regulation, and it is also observed that if both the parents are allergic, 50% chance that their child will be allergic, and if one is allergic, only 30% chance that the child is allergic. Dose, the dose is a definite pose and definite impact. It is observed that repeated small dose of allergen, that is repeated small dose of allergen induce a persistent IgE response. In mice with higher dose will lead to transient response which shifts towards the IgG response. Therefore, if a repeated small dose is given, the chances of the allergic reactions are less compared to the higher doses. Now, Th1 and Th2 response, the balance between the Th1 and Th2 2 response determines the response. The Th1 response produces the cytokines, which is inhibited type 1 hypersensitivity, while we have already seen it is type 2 Th2 that is mainly responsible for the type 1 hypersensitivity, and we've already seen that type 2 will release interleukin 4 and interleukin 53. So interleukin 4 is mainly responsible for causing the type 1 hypersensitivity, and 53 will cause what? Eosinophil recruitment. ठीक है, एंड इट इज इंटरल्यूकिन 4 वो जो आगे जाके बी सेल को एक्टिवेट करके आईजीई रिलीज करवाएगा, एंड दिस विल सेंसिटाइज व्हाट? सेंसिटाइज द मास्ट सेल. डिटेक्शन, नाउ डिटेक्शन के लिए एक तो हमने एक्सपेरिमेंट देखा था जरा पीके रिएक्शन, पीके साइंटिस्ट दैट दे सॉ द टाइप 1 hypersensitivity, and another is the skin prick test, that is skin prick test, that is the small amount of the allergens are introduced at the different site either by the intradermal or the superficial scratching. So skin prick test में अपन क्या करेंगे कि small dose of allergen, ठीक है, they are actually exposed to different skin either by the intradermal or by the superficial scratching. ठीक है, if a person is already sensitized, a wheal and flare response will develops within 30 minutes. If the person is already sensitized, so secondary reactions will take place. Secondary exposure हो गया ये तो wheel and flare response will come under 30 minutes. Advantage is that it is expensive and screening can be easily done. Disadvantage that it may, even if the person is not sensitized, we are actually sensitizing the person. तो next time क्या हो जाएगा कि उसका secondary exposure हुआ तो it will lead to the reaction. So unintentionally we are sensitizing the person to a new allergen that for whom he was not sensitized before, right? And even the person is sensitized, अगर हमने उसको वापस sensitize किया तो patient may show the allergic reactions and even show the anaphylactic shock and even leading to the death. So this is the disadvantage. तो स्किन टेस्ट में कुछ नहीं करते, स्मॉल डोज ऑफ एलर्जी डिफरेंट डिफरेंट स्किन साइट पे लगाएंगे या तो इंटरडर्मली या फिर स्क्रैचिंग से. अगर विद इन 30 मिनट्स उसका रिएक्शन आ रहा है इसका मतलब पर्सन पहले सेंसिटाइज था और सेकेंडरी एक्सपोजर पे डीग्रेनुलेशन होके इन्फ्लामेटरी रिस्पॉन्स उसने दिखा दिया. सो दिस इज व्हाट अबाउट द this is how the skin prick test is done, that different allergens that are as added to the skin and we see the reaction. Now, total IgE antibody, quantitative detection of the IgE is performed by the various formats, that is enzyme immunoassay or the radiometric assay that is called as the radioimmunosorbent test. Okay, now no more we used to use the wrist to see the quantitative analysis of the antibody. IgE detection is more specific than the total IgE, that is allergic specific IgE is more specific than the total IgE, and various tests. There's this name, just read the test, not so important. That is multiplex immunoblot, automated immunoassay test, and the anti-CCT absorbent, and the rest that is a radiometric assay test called as radio allergosorbent test. Now, for what we can do for the treatment. Yeah, so the first basic treatment, if I know that I'm allergic to this particular allergen, to peanut or whatever, then avoid the contact with the known allergen. The first and the foremost step is the identification, and then it is what the avoidance of the contact with the allergen to the dust, such as dust or the pets or the food. However, it is not practically possible because most of the people they do not know what they are allergic to, and it is not possible to avoid all the allergens specifically in India. Now, hyposensitization, repeated exposure, that is when we give the repeated exposure to increased subcutaneous dose of allergen can reduce or eliminate the allergic response. ठीक है, so what we do, give the repeated exposure to the person and the allergic response will consequently will decrease on every day by the person. That is, a shift of the IgG will occur towards the IgG and a shift of the TH2 will occur towards the TH1 and TH1 is inhibitory for the type 1 reactions. ठीक है, तो सबसे पहला काम ये करना है कि जो एलर्जिक जिसके लिए वो सेंसिटाइज्ड है उसको अवॉइड करो, अगर अवॉइड नहीं हो सकता तो फिर ज्यादा सेंसिटाइजेशन कर दो। तो मतलब क्या करो, रिपीटेड एक्सपोजर देते जाओ, तो दिस विल अकर वॉट द शिफ्ट ऑफ द इम्यूनिटी कि आईजीजी जो हाँ वो लॉन्ग टर्म इम्यूनिटी की तरफ जाएगा, दैट इज आईजीजी। आईजीई वाज रिस्पॉन्सिबल फॉर टाइप 1, दिस विल शिफ्ट टुवर्ड्स द प्रोडक्शन ऑफ द आईजीजी। ठीक है, तो टाइप 1 रिएक्शन नहीं होगा। दूसरा ये कि TH2 was mainly responsible for activating the B cells, तो TH2 will shift towards the formation of the TH1 cells और TH1 cell is inhibitory to type 1 reactions. ठीक है, which we secret IFN which can turn the suppress the IgE response. Now, the IgG allergen immune complex can be removed later by the phagocytosis. Monoclonal anti-IgE, that is another treatment we can do is humanized monoclonal anti, that is antibody के against antibody दे दो। ठीक है, and this is possible because we read in the antibody class कि antibody में भी एक allergen this antigen की site होती है variable region पे, तो giving the antibody against the antibody, that is monoclonal anti-IgE, that will block the IgE and type 1 will not occur. Other than these, the drugs that is useful in the various mechanism, that is antihistamines, that is block the H1 receptors. Other than this, the epinephrine, adrenaline. Another is the cortisol, theophylline, and the chromyl sodium. We already know about the antihistamines, penicillin, and the cortisol, theophylline, and the chromyl sodium, that is blocks the calcium influx into the mast cell. I will not go into the detail of the this mechanism of action for these drugs. That is, just remember the name of the drugs. Now, coming to the type 2 hypersensitivity. Type 2 hypersensitivity, this was what? This was cytotoxic and it was mainly IgG and IgM antibody mediated, right? एंड व्हाट हैपन्स कि क्या होता है, कोई एंटीजन बाहर से आया, वो खुद की सेल पे जाके चिपक गया अपनी सेल पे, तो जो सेल अपने लिए नॉन थी इट विल टर्न आउट इनटू अ फॉरेन सेल एंड दीज एंटीबॉडी दे विल स्टार्ट अटैकिंग are on cell, leading to the type 2 hypersensitivity reaction and activation of what? Complement system, क्योंकि IgG and IgM were activating what? Complement system and causing what? The membrane attack complex and the autoimmune reactions. And what were the examples that we saw? That is the rheumatoid fever, rheumatic fever, good pastures disease, hemolytic disease of the newborn की एक और, that is erythroblastoma fetalis. इसके अलावा Graves' disease example of both the type 2 and the type 5. Okay. Now, in type 2 reactions, the host injury is mediated by the antibody IgG, rarely IgM, which interact with the various type of antigens. That is the host. इसको अपन बोलते हैं cell bound antigen. क्यों बोलेंगे? वेरी इजी, क्योंकि सेल पे चिपका हुआ एंटीजन है, दैट इज सेल बाउंड एंटीजन विल एक्टिवेट द टाइप 2 hypersensitivity reactions. That is RBC membrane antigens like blood group and even RH antigens, they can also activate. So both the intrinsic and the extrinsic antigens can activate. Other than this, the external cellular matrix or oxygen antigens that are observed from outside, even the self antigens that are already present on the RBC membranes and the antigens that has been taken from outside, to intrinsic and the extrinsic antigens. Now, after antigen binding occurs, antigen antibody binding occurs, the FC region of the antibody यहाँ पे जाके अपने अटैच हो गया, what? अपना एंटीबॉडी जाके अटैच हो गया एंड हेयर द एफसी रीजन इज फ्री, सो दिस एंटीजन एंटीबॉडी अकर्स एफसी रीजन में एंटीबॉडी इनिशिएट द टाइप 2 रिएक्शन थ्रू द एक्टिवेशन ऑफ द कॉम्प्लीमेंट। यहाँ पे अपन को पता है कॉम्प्लीमेंट फैक्टर्स कहाँ के अटैच होते हैं? एफसी रीजन पे, तो कॉम्प्लीमेंट फैक्टर्स विल अटैच एंड दिस विल एक्टिवेट द टाइप 2 रिएक्शंस। तो कुछ नहीं है, एंटीजन है चाहे इंट्रेंसिक एक्सटेंसिक हो, उसने अपनी सेल देखी, वहां पे जाके चिपक गया एंड दिस इज द सेल बाउंड एंटीजन। यहाँ पे उसने रिकॉग्नाइज्ड बाय द IgG and IgM and they will attach, okay, and they will attach to the Fab fragment and FC fragment free है, यहाँ पे आके complement factors will attach activating the complement system and this is leading to the type 2 hypersensitivity reactions. So it is what? It is complement dependent reactions. That is, the Fc region of the antibody that has been bound can activate the classical complement pathway, and we have already seen the classical complement pathway is antibody dependent pathway, कल ही पढ़ा था, and it is mediated by the IgG and IgM. ठीक है, तो complement dependent pathway है the membrane attack complex. That is the membrane attack complex क्या था अपने पास C5, 6, 6, 7, 8 and 9 formed by the activation they produce the pores in the cells of the person leading to the lysis. Another is the complement dependent inflammation क्योंकि complement pathway acquired immunity भी है, innate भी है, causes the inflammatory response, and the byproducts such as the C3A, C4A, C5A they are was causing the anaphylatoxins causing the inflammatory reactions. Other than the C3B and C4B, they will cause the opsonization, increase the phagocytosis of the cells, and they deposit on the target cell and phagocytosis, right? Complement mediated type 2 reactions, antibody dependent. That is, complement mediated type 2 reactions observed in various clinical conditions. We have already seen. One is the transfusion reactions. That is a एबियो इनकम्पैटिबिलिटी, इसके अलावा एरिथ्रोब्लास्टोसिस फीटलिस, hemolytic disease of the newborn, erythroblastoma fetalis, and another we've seen the rheumatic fever, good pastures, and the grave disease. Drug induced hemolytic anemia will also show, and examples, that is the penicillin, for example the quinine and the penicillin. ठीक है, and the pemphigus vulgaris proteins that lead to the disruption of the epidermal. And remember the five examples that are important, that is rheumatic fever, good pastures, myasthenia gravis, and the HDN, and the erythroblastosis fetalis, right? So, antibody dependent cellular cytotoxicity. The IgG antibody can caught on the target cell by interacting with the surface antigen, that is the Fab, and the Fc region in turns bind to the various such as the NK cells, which results in destruction of the target cell. So, type 2 hypersensitivity can be both the complement mediated as well as the antibody mediated cytotoxicity. Complement mediated we already seen कि जब antibodies they get attached the Fc region वहाँ पे जाके either complement system can bind, other than this the NK cells can also bind, and when the NK cells will bind, this will that the Fc receptors on the various effector cells, that is the Fc portion of the IgG, this will bind to the NK cells because the receptors will be present on the NK cells for the Fc region, and this is antibody dependent cellular cytotoxicity. So दोनों अलग अलग हैं. One is the complement mediated, another is the antibody mediated. Mainly complement mediated is responsible for the type 2. ADCC is involved in the destruction of the targets that are too large to be phagocytized, that is the parasite tumors and the graft rejections. Although ADCC is typically mediated by the IgG, in certain instances even IgG antibodies are used. So there is a difference between the complement mediated and the antibody mediated cytotoxicity. Now, in this condition, the host produces a certain autoantibodies which binds and disrupts the normal function, and anti-receptors AB causing the activation of the receptors, and this in Graves' disease here the autoantibodies produced are called the LETs. Not important to remember. So just remember the two types of cytotoxicity that we have read. Examples we have seen already for the type 2 hypersensitivity. This is a complement in the antibody, easy to remember. Complement में कुछ नहीं हो रहा, जो antibody का FC region है वहाँ पे complement factors वो जाके attach जाएंगे and complement system will be activated. But antibody dependent here at the site of the antibody FC fragment, the NK cells will bind with the NK cells, right? So it can be both. antibody dependent cell, and complement mediated cytotoxicity. Now we'll come to the type 3. Now, type 3 hypersensitivity reactions develops as a result of excess formation of the immune complex क्योंकि हमने पढ़ा था acid. Acid में A stands for anaphylaxis, atopy, allergic. C for the cytotoxicity, that is about complement and the antibody, and the I say immune complex, and D say delayed. That is the type 3 hypersensitivity results of the excess formation of the immune complex, that is antigen antibody complex, right? We have already seen कि immune complex बन जाते हैं. कई बार क्या होता है कि जो antigen antibody होते हैं complex बन के freely घूमते रहते हैं blood में, फिर वो जाके accumulate हो जाते हैं blood में, this basement membrane of the system and the organs, and वहाँ पे जाके this will activate the complement and the reaction will occur. So antigen involved can involve the exogenous antigen as well as the endogenous, that is mainly the DNA fragments or the exogenous fragments, and mere formation of the immune cause doesn't result in type 3. Under normal circumstances, what happens that immune complex are they are cleared by the complement system, that is they are cleared by the immune system complement system, but immune complex coated with the complements are either directly phagocytized by the macrophage or are bound to the RBC or carried to the liver spleen where they are phagocytized. However, in some situations, the immune system may be exposed to excess dose of the antigen. This is important. This line is important, that is excess dose of antigen over a longer period of time and repeated exposure. So what happens is that the antigen antibody complex, they are cleared by the immune system, but sometimes the antigen is so much in number, in higher concentration, the chronic infection that the complex they are not removed by the body and they get lodged in the basement membrane. So now a balance between a level of the antigen antibody decides the nature of the immune complex that is going to be formed. In case of the antibody axis or antigen antibody equivalence, immune complex are what? Soluble, that will localize near the site of the antigen demonstration causing the type 3 hyperreaction, while in situation when antigen is axis, small complexes are formed which tends to travel and get deposited in the various sites. ठीक है, so अगर एंटीबॉडी ज्यादा है या फिर एंटीजन एंटीबॉडी इक्वलेंस में है, देन दे विल, क्योंकि ये लार्ज है, ठीक है, एंड सिंस इट इज लार्ज, ये लोकल साइट पे एल से एल, सो दे विल डिपॉजिट एट द लोकल साइट एंड कोज द टाइप 3 हाइपर सेंसिटिविटी रिएक्शन. अगर एंटीजन ज्यादा है, एंटीजेंस आर स्मॉल, दैट इज एंटीजेंस अगर ज्यादा है तो स्मॉल सोल्यूबल कॉम्प्लेक्स विल बी फॉर्म्ड, स्मॉल कॉम्प्लेक्स, और वो वैंडर करेंगे तो दे विल गेट डिपॉजिटेड इन द वेरियस साइट्स. ठीक है, इजी टू रिमेम्बर. अगर एंटीजन ज्यादा है, एंटीजेंस वी कैन कंसिडर कि छोटे छोटे एंटीजन स्मॉल है तो वैंडर करेंगे कॉम्प्लेक्स बनकर और वो जगह जगह डिपॉजिट होंगे. अगर एंटीबॉडी ज्यादा है और एंटीजन एंटीबॉडी कॉम्प्लेक्स है तो लार्ज होंगे, तो जहां के वहीं टाइप 3 हाइपरसेंसिटिविटी रिएक्शन करेंगे. नाउ मैकेनिज्म वी हैव सीन दैट क्लासिकल कॉम्प्लीमेंट एक्टिवेशन stimulate the classical pathway of the complement and the product which mediate the type 3 reactions. Anaphylotoxins complement of C3A and C5A and C4A, this will cause the anaphylotoxins. Chemoattractants C3A, this A are what also the chemoattractants, and the neutrophils attempts to phagocytize the large immune complex but fail in doing so. Now, platelet activation, immune complex binds to the Fc region that is present on the platelet, also leading to the activation of the platelet as well, right? And causing the release of the amines and further leading to ischemia and the damage and the activation of what? Hagman factor leads to the activation of the kinin, which in turns will cause the vasodilation and the edema. Now, टाइप 3 आर इधर लोकलाइज्ड और जनरल. वी हैव सीन लोकलाइज्ड कैसे था कि अगर एंटीजन ज्यादा है, एंटीबॉडी ज्यादा है, कॉम्प्लेक्स बड़ा है तो लोकलाइज करेगा. एंटीजन छोटा होता है, दिस विल वेंडर at various sites and cause the type 3 hypersensitivity at various locations. Now, localized or the Arthur's reaction is defined as a localized. Remember, when it is localized, it is called as the Arthur's reaction. Okay, and it will release, causing the vasculitis, causing the acute immune complex deposition at the site of the inoculation. And the reaction is produced by the experimentally by injecting the antigen to skin, and the circulating antibodies bind with the antigen, the dermis form the immune complex. These immune complex fix the complement, resulting in the localized immune complex mediated inflammatory response called Arthur's reaction. कुछ नहीं है Arthur's reaction, अगर एंटीबॉडी ज्यादा है या एंटीजन एंटीबॉडी कॉम्प्लेक्स है जो कि बड़ा होता है, this will localize, will give the localized type 3 hypersensitivity reaction, and this is called as the Arthur's reaction. Okay. In the skin following after the insect bites and during the allergic desensitization treatment, in this even in the lungs following the inhalation of the bacteria, fungi and the spores. Now this includes the farmer's lung. Okay, these are the examples of the Arthur's reactions, but the classical examples of the type 3 we have already read about the SLE, SAS. SL is a serum sickness, and glomerulonephritis and the arthritis. Generalized formation, generalized in the systemic, we have seen that is the small sized antigen or the small immune complex. They will wander and they will cause the systemic type 3 reactions. Okay, and this will induce inflammatory reactions wherever they are deposited. Serum sickness. This is another historic example. That is, this condition is not seen and it was seen in the past. The host serum proteins being a foreign can induce antigen antibody formation, leading to generation of the large number of the immune complex. Typically after 7 to 8 days. The symptoms include the hypersensitive reactions, causing the fever, weakness, vasculitis, and they generally subside once the immune complex are cleared by the body. So whatever happening in the type 3 is due to the formation of the immune complex, that is the antigen antibody complex. Depend करता है कि complex छोटा है या बड़ा. छोटा है तो wander करेगा and it will cause a systemic reactions. अगर बड़ा है complex so it will cause the Arthur's reaction or the localized hypersensitivity type 3 reactions. Now coming to the last hypersensitivity, that is the type 4 reactions. That is, this occurs in the two phase similar to that of type 1 reaction, that is the sensitization phase, and another is the effector phase. Yeah. Now sensitization phase, this is the initial phase of 1 to 2 week following the antigen exposure. Type 4 में अपने क्या याद किया था? It is a delayed type of hypersensitivity, cell mediated type of hypersensitivity, and antibodies are not involved. Therefore, it is not dependent on the antibody. कौन सी cell involved थी? Dendritic cell. They were acting as the antigen presenting cell, thus activating the CD4-8 and CD8 cells and releasing the interferons gamma cytokines, right, and damaging the target cells and the organs, target organs. And what were the examples? कैसे याद किया? D से contact dermatitis, D से diabetes mellitus 1. Delayed की बात करें तो TB also represent late. We remembered like this the tuberculosis and the multiple sclerosis in the same way. During this period, the APC processes and present the antigen with the MHC class 2. ठीक है? And the TH cells will differentiate between the CD4 T cells and the 8 cells, and the effective phase on subsequent contact secret variety of the cytokines, interferon gamma and the cytokines, and results into the activation of the macrophage and the inflammatory response. We read it in very small chart. When the starting of the 30-minute of the class, we read about all the hypersensitivity reaction. How do they do the mechanism of how do they do their mechanism in the body? So in a concise form, we have already covered. And what were the examples that we've already vaccine. That is a type 4, that is 2 phase sensitization effector phase. Sensitization में कुछ नहीं होगा, बस पहले जो APC cells है they will present to the TH cells and they are sensitized, and in the effector phase the TH cells, TH4 CD4 TH cells, they will release the interferons and the cytokines. Now, role of the DTH, that is the tissue damage response. Protective as a tissue damage response house attempts to provide the defense against many intracellular microorganisms such as MTB as well as several chemicals. Always attempts do not result in the protection. Now, protective response under normal circumstances, what happens? The pathogens are usually cleared, right, with enhanced microbial potency. Tissue damage response, however, in conditions when the intracellular microbes escape the macrophage, whatever we see in the TB, that the bacteria escape the macrophage killing and inside the macrophage and release various lytic enzymes by the activated macrophage because they are present in the macrophage, and instead of the being they killed, they activate the macrophage, release the cytokines and interferons, therefore causing the inflammatory reactions and delayed type of hypersensitivity. So DTH में क्या होगा? Granular formation, that क्योंकि अपन TB ही पढ़ रहे हैं, TB delayed type of hypersensitivity. So DTH reactions for killing the intracellular microbes leads to the formation of what? Formation of the granuloma. That is the granuloma formation. Now, the initial TH cell infiltrate progressively replaced by the macrophage, transformed into two types of cells, that is macrophage. That is inside the macrophage, the bacteria is present. It will either become large, flat, eosinophilic or epithelioid cells or multinucleated giant cell. Okay. Now, granuloma consists of the inner zone of the epithelioid cells, typically surrounded by the lymphocytes and the peripheral rim of the fibroblast. ठीक है, granuloma कुछ नहीं है, that macrophage that is consisting of the bacteria that escape the phagocytosis will activate the macrophage to transform itself into either epithelioid cells, or the epithelioid cells will fuse together to form the multinucleate giant cells, and granuloma is formed consisting of epithelioid cells surrounded by the lymphocytes and the fibroblast. Now, that is where are the examples where DTH is occurring? Wherever the granuloma formation is occurring, right? That is the TB, Mycobacterium, Listeria brucella, and fungus, that is the Pneumocystis candida. And that two, we already know that these are intracellular pathogens, Histoplasma capsulatum and the Cryptococcus, and the viruses, that is the herpes, variola, and the measles. मीजल्स में एक सेल भी अपन को मिलती थी, दैट इज अ डब्ल्यू से वर्क थी ट्विंकल दी सेल्स. ठीक है, तो इंटरसेलुलर पैथोजेंस कौन से थे? एक तो ट्यूबरकुलोसिस, टीबी वी हैव ऑलरेडी सीन, फंगस वी ऑलरेडी नो, टू इंट्रा सेलुलर दैट इज हिस्टोप्लाज्मा क्रिप्टोकोकस, इसके अलावा कैंडिडा, न्यूमोसिस्टिस, एंड द इंटरसेलुलर वायरसेस दैट इज द एचएसवी मीजल्स. नाउ कॉन्टेक्ट डर्मेटाइटिस फॉलोइंग एक्सपोजर टू कॉन्टेक्ट एंटीजन्स के चार क्लासिकल एग्जांपल हमने पढ़ा था. डिलेड टाइप ऑफ हाइपरसेंसिटिविटी, डी से डी, दैट इज द डर्मेटाइटिस, दैट इज द कॉन्टेक्ट डर्मेटाइटिस. अनदर इज द डायबिटीज मेलाइटिस टाइप 1, इसके अलावा टीबी, एंड वन वाज द मल्टीपल स्क्लेरोसिस. Okay, so when we talk about the dermatitis, that is due to exposure to the contact antigen, nickel, and the poison, and the non-infectious conditions, that is the diabetes mellitus type 1, multiple sclerosis, Hashimoto Crohn's, transplant rejections, and the graft versus host disease. Okay, that is also coming under the type 4, the type of hypersensitivity. Other than this, wherever the granular formation we are seeing, these examples will also be included in the type 4 hypersensitivity, that is a TB, sarcoidosis, schistosomiasis, and lepra. Now, comes the tuberculin test that we do. It is a prototype of the delayed type of hypersensitivity in sensitized individuals that are already sensitized, right? And further exposure is done, they will lead to what the type 4. When a preparation of the tuberculin antigen is injected what intradermally, it develop after 48 hours to 72 hours, consisting of the induration surrounding by the erythema. Okay, so tuberculin test is a prototype of the delayed type of hypersensitivity, and we use it for the microbacterium tuberculosis, and we'll see the response within 48 to 72 hours. Many antigens such as nickel poison, they act by the DTH response, and this hapten skin protein complex is internalized by the skin APCs. That is, most of these substances are haptens. Since haptens are incomplete antigens, they are taken up by the APC because haptens are incomplete antigens. So what will happen, that will they will complex with the skin proteins to act as a complete antigen taken by the APC and presented to what the H cells, and activating the similar type 4 hypersensitivity reaction. Okay, so today's session was a bit long. That is all the type 4 hypersensitivity reactions we have covered. Just initial 30 minutes of the session was very important. 30 to 40 minutes क्योंकि उस सब उन्होंने सारे hypersensitive reactions के mnemonic के examples we already covered, and later we covered the theory for the examination point of view for the professional examination as well. And please do use my code, that is Muskan 10, to get 10% of the discount for the NEET PG subscriptions. And soon we'll starting with the 2022 preparation, and all the students who are preparing for the coming exam, I wish you all the very best. Do not panic. Whatever read is enough. Just don't change your subject matter, and revise the volatile subjects again and again. And do not stop reading, and just give grand tests to increase your capacity, and so that you do not lose the stamina for giving the examination for continuously for 3 hours and additional 2 3 hours to travel. So this is very physically exertion takes place a lot on the same day. So I do not want you to have that. So practice grand test continuously, and do not look at the marks you're going to obtain in the grand test, because that is not going to matter right now. Because abhi we are already panicked, so we will not be able to perform good in the grand test right now. So do not look at the marks, and even don't look at the solution if you do not feel so, but have the sitting power, sitting capability, so that you do not lose the stamina during the examination, and your mind doesn't wander during the examination. Okay, so session was important today. Hypersensitivity, the main mechanism were important to remember, and the examples were important. Question answers will cover in the next session. Today only the concept was something that was being cleared. The artist reaction kya hota hai, and how the type 1, 2, 3, 4 were acting. So see you in the next session. All the best. So take care and bye bye.